If you look on your webpage, there is a link to the Vermont statute around consent. And Katie is just a high-level summary of that for us, okay? Whenever you're ready, Katie.
Thank you. Katie McKnight, Office of Legislative Counsel. I'm sorry I couldn't find it quickly.
Oh, that's, yeah. It's like trying to, write statute when everybody's watching you,
Right. I was also looking to see if there's something specific in the immunization chapter. So here it is, and I don't know what I'm doing. No. Oh, I'm not logged in. Do you have it on your?
Yeah, we have it on our iPads. You don't need to do it. And
You
people
think
can
this is
access,
on the-
it's on our website.
Okay, thank you.
Okay, so we have language that just defines what lack of informed consent means. So I think it's nice to look at the specific language there. It's the failure of the person providing the professional treatment or diagnosis to disclose to the patient such alternatives thereto, and the reasonably foreseeable risks. That's the language that Lauren was really emphasizing. And benefits involved as a reasonable medical practitioner under similar circumstances have disclosed in a manner permitting the patient to make a knowledgeable evaluation. So this is talking about one, what the practitioner themselves could anticipate, but also disclosure in a manner that the patient receiving the information can take in. And then we have an or, the failure to disclose the information required by D. D says that the patient shall be entitled to a reasonable answer to a specific question about foreseeable risks and benefits, and the medical practitioner shall not withhold that information. And then the language goes on to say that a person, there could be an action brought to recover for medical malpractice based on the lack of informed consent. But this wouldn't apply in the case of an emergency, like emergency medical care. So I think that's sort of the high level there, and that this applies not just to immunizations, but this applies across medical practice.
Across medical practice, yeah. So there's existing law with regard to what the patient's rights are when it comes to healthcare professionals practice, I guess is what you say, I guess what the word is. Okay, so I just wanted to make sure that committee members know what existing law is. And do you have any, I'm going to say quick or Katie? Okay, great. Thank you so much, Katie.
Yeah,
appreciate it. Thank you for being so flexible today. I really appreciate it.
Thanks a lot. Get out of here.
Okay, speaking of flexibility, thank you to our witnesses from Community Action for being so flexible. We are going to now move to page 594. We're changing topics. We will have additional witnesses on the amendment before us on 545 right at 1 o'clock. We'll be hearing from the pediatrician who spoke to us previously. So we want to get the physician perspective about the proposed amendment. So we've heard from the department. Now we want to hear from people who are practicing, and we've also heard from the amendment sponsor. So have to get all rounds on this. Thank you, Representative Eastis, for being very flexible as we move along on this day. Okay, so welcome. We're going to do a quick round of introductions just because I think Jenna's been here on Zoom already, but I don't think Paul's been here yet this year. So Teresa Wood from Waterbury, also representing Bolton, Buellscore, and Huntington.
Hi, Ray Garofano, Essex and Essex Junction. Nice to see you both.
Hey, I'm Jubilee McGill, and I represent Bridport, Middlebury, Haven, and Lightbridge.
Hello, Esme Cole of Hartford.
Good morning, Son. I live in Guilford, and I also serve in God Hills and Bishop Colchester.
Brenda Steady, Westford, East Milton.
Hi, good morning. Eric McGuire, Rutland City. It's good to see you both.
Good morning, Dan Noyes, Woket, Hyde Park, Johnson, and Belvedere. Thank you.
And we'll start with the press right up here.
James Maloney, NBC5 News.
Ethan Carpenter, Zatz Rent Group Consultant.
Chad Simmons, housing and homelessness land, Vermont.
Schoenberger.
Not on, not on the floor.
Yeah.
My computer's.
Oh, your computer. Oh, okay, that's all good.
Just people, if I didn't access from. Definitely go back to the Vermont Early Child Care Advocacy Alliance.
Larry Morris Committee Assistant.
And Representative Donahue.
And I'm here from Northfield in Berlin. Apologies for the delay.
So thank you for being here. Thank you. As you know, we've been working on this issue for a long time. We're hoping to make some progress this year, and we appreciate both of you being here today to give us your reactions, your thoughts and processes about different elements of this bill, things that you might think could be helpful and things that you think might not be helpful. Appreciate you both being here. I'm going to say particularly because we are in some very cold time right now and heading into a weekend where I know that you are going to be incredibly busy. I'm just going to pause just for a moment. I'm not going to ask you to get out of your seats. I am going to ask our witness if he's able to come back at 1 o'clock.
Yes.
Thank you. So I was not going to plan D, I promise. So welcome to both of you.
I'm Jennifer Farrell. St. Johnsbury. I'm the executive director of Northeast Kingdom Community Action. President of the Vermont Community Action Partnership. Start at the very beginning. It's a very nice. And we started at the beginning, and we think that has a purpose. So today we're here to give a response to purpose statements as stated in 8591. I'd like to highlight for the court, and I'll read, and I guess I'll periodically look to be stop or have that.
Yeah, you can, why don't you go through your testimony, and if you see a place where you think that people might have questions, I'll keep my eye out, but I think I don't want to interrupt you, so.
Okay, feel free. That's helpful. Today we'd like to highlight some of the core features of H91. H91.
Oh.
I need to read this. Oh, take two?
Yeah.
Today, let's highlight some of the core features of 594 that we fundamentally do not support as stated in section 1 purpose. We believe that it's critical to address the purpose of the bill before we make further suggestions about language. As always, the 5 community action agencies are ready and willing to work with your committee to ensure the best outcomes for everyone who lives in Vermont, including and especially people who are at risk or experiencing homelessness. Like walk through the purpose statements and provide comments. We're happy to work with others and provide specific suggestions for purpose language next week. The first, number 1, is to ensure that the narrowly tailored temporary emergency housing assistance is available to only the most vulnerable Vermonters in crisis through fiscal year 2028 in a manner that encourages efficient and accountable use of taxpayer funds. We respectfully disagree with this approach. We believe that all people deserve shelter. A narrowly defined eligibility framework is neither inclusive nor equitable and fails to reflect the realities of homelessness. When access to shelter is restricted to tightly defined categories of most vulnerable, many people in genuine crisis are excluded, many of those with the fewest resources to navigate the complex systems. This approach reinforces inequity rather than addressing them. Limiting access to shelter does not inherently promote efficiency or accountability of public funds. In practice, this often shifts costs elsewhere to emergency rooms, law enforcement,
child welfare, and crisis systems, all the while prolonged homelessness and increasing long-term public expenses and impact on our communities. True fiscal responsibility is achieved by providing timely, low barrier access to shelter that stabilizes people quickly and reduces the need for more costly interventions. Emergency housing assistance should be guided by a human-centered, equity-driven framework that recognizes homelessness as a crisis that needs emergency response. Accountability is best achieved through clear outcomes, coordination with community providers, and transparent use of funds, integrating service system and not narrowing access in ways that leaves vulnerable Vermonters without life-saving support. Second statement. Establish clear eligibility criteria, accountability measures, and case management. Third statement. Establish clear eligibility criteria, accountability measures, and case management requirements as it is presented. Eligibility for emergency housing assistance is already clear. Individuals and families are literally homeless. Adding additional eligibility criteria beyond literal homelessness risks excluding people in crisis and creates unnecessary barriers to life-saving shelter. Please note that our staff and the staff at other providers are already very skilled at engaging people in case management, housing plans, benefit navigation, and accessing additional services. The call for greater accountability is also unclear. Accountability to whom and for what purpose? The Housing Opportunity Program providers already operate with significant oversight, including monitoring of financial and service provisions, as well as habitability visits and checks on all of our shelters. Providers collect and submit detailed data, develop and manage approved budgets, and regularly report outcomes to the state. These accountability structures are already in place and are functioning. No new deficits have been identified to justify additional requirements. Finally, the proposal introduces case management requirements without defining what case management entails or how it would be implemented. Case management should be available support, not a condition of accessing a shelter. Requiring participation undermines trauma-informed, person-centered approach and may discourage people from seeking help at all. Emergency housing must remain low barrier, voluntary, and responsive to individual needs, recognizing that stability and trust are often prerequisites to engagement and not the results of mandates. We already use proven techniques for client engagement, including meeting people where they are, motivational interviewing, community building, housing and financial education, and intensive service support. The third statement. Transition from reliance on hotels and motels towards sustainability, permanent housing solutions, including recovery housing, transitional housing, and the Vermont Housing Investment Program. We agree with the goal of transitioning away from reliance on hotels and motels towards sustainable permanent housing solutions, including recovery housing, transitional housing, and the Vermont Housing Investment Program. However, this transition must be accompanied by one-to-one replacement of hotel and motel capacity with community-based shelter beds. Any shift in strategy should be grounded in a data-driven assessment of current need, regional capacity, and system impact to ensure that people experiencing homelessness are not displaced or left without access to safe shelter. Without sufficient replacement capacity, reducing hotel and motel use risks increasing unsheltered homelessness and undermining very outcomes these long-term housing investments seek to achieve. A responsible transition prioritizes continuity of care, geographic equity, and adequate shelter capacity, while permanent housing solutions are developed and brought online. 4, establish a tiered continuum of care. Disagree with the idea of establishing a tiered continuum of care if it implies a linear or prescriptive system. Tiered support often attempts to fit people in predefined levels of service rather than meeting people where they are. This approach can unintentionally force people into interventions that do not align with their needs, preferences, or readiness. A best practice case management system builds trusting relationships grounded in dignity and recognizes that people experiencing homelessness are the experts in their own lives. They should have meaningful voice and No.